Hello, my name is Maria Cabral. I am going to present video regarding prenatal education, healthy pregnancy. I am in the appropriate school uniform. My badge is visible. My nails are short and clean. My hair is tied back. During pregnancy, regular appointments with your healthcare provider are essential to monitor the health of both the mother and the baby. Typically, appointments occur every 4 weeks until 28 weeks, then every 2 weeks, and finally after 36 weeks until delivery. At your first appointment, the provider will review your medical history, family history, and surgical history. They will also discuss any medications and risk factors and provide an estimated due date for the baby. They will also check your vitals, particularly your blood pressure, perform a pelvic exam, and collect urine sample for analysis. Depending on how far along you are, you may have an ultrasound, which is typically done around 12 and 20 weeks to monitor fetal development of the baby. Routine labs such as blood tests for anemia and glucose screening for gestational diabetes will also be performed. From 10 weeks onward, the provider will use a fetal Doppler to listen to the baby's heartbeat, check fundal height to monitor growth, and perform an anatomy scan about 20 weeks, which is when you can also find out the baby's gender. Around 28 weeks, you may receive the Tdap vaccine, and if you are Rh negative, a RhoGAM injection will be given as ordered. From 36 weeks until delivery, appointments will include routine checks as well as monitoring the baby's position, checking your cervix, and performing the Group B strep test. Your provider will also educate you about signs of labor, contraction through false labor, and warning signs, and what it's like if the water breaks. Throughout the pregnancy, lab works include CBC, blood type, Rh factor, and test for HIV. Optional genetic screenings include blood tests for Down syndrome, the NIP and quad test, and neural tube defects, the AFP, as well as more invasive tests like the myocentesis and chorionic villus sampling for detecting genetic abnormalities. When it comes to nutrition and supplement, maintaining a healthy, balanced diet is vital during pregnancy. It is recommended to increase calories about 300 more per day and focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. It is also important to take prenatal vitamins that include iron, folic acid, and calcium, which are vital for preventing birth defects and ensuring a healthy fetal development. It is also recommended to take 600 micrograms of folic acid per day to lower the chance of neural tube defects. Foods like fish, dairy products, and leafy greens and fortified cereals should be part of your daily meals. Also, taking omega-3 fatty acids helps in the brain development of the baby. When it comes to exercise during pregnancy, staying active is encouraged during pregnancy with activities like walking, swimming, or prenatal yoga being safe options. It's recommended to exercise for at least 150 minutes per week. However, avoid high-impact sports, heavy lifting, and activities that put you at risk of falling or injury. When it comes to weight gain recommendation, healthy pregnancy weight gain is based on your pre-pregnancy BMI. If you are underweight, aim to gain 28 to 40 pounds. For normal weight, it's 25 to 35 pounds. And for overweight, it's 15 to 25 pounds. And if obese, it's 11 to 20 pounds recommended weight gain. And for gradual weight gain is vital to support the baby's development while minimizing health risks for both mother and the baby. When it comes to common pregnancy complaints and relief, common complaints include nausea, heartburn, and constipation. For nausea, try eating small frequent meals, and you can also incorporate drinking hot ginger tea. And for heartburn, avoid spicy and oily foods, and it's recommended for pregnant women to eat slowly. For constipation, make sure to eat food high in fiber, drink adequate amount of fluids, and you may also take over-the-counter stool softener as needed if recommended by the provider. For warning signs of pregnancy, certain warning signs during pregnancy require immediate attention. If you experience heavy vaginal bleeding, it could indicate miscarriage or placental problems. For severe headaches, it could be a sign of preeclampsia, which is extremely high blood pressure. And sudden decrease in fetal movement could indicate fetal distress. So always contact your provider when you experience these symptoms. Thank you for listening and have a good day. Bye-bye.